Your scan shows degenerative disc disease. The word sounds scary, but here's what it actually means. Between each vertebra sits a soft disc that cushions the spine. With age, these discs lose water and thin out. Over time, discs lose height, small tears appear, and bone spurs may form. Nearby nerves can get irritated. It most often affects the lower back and neck, since these areas carry the most movement and weight every day. Pain often comes and goes. Sitting, bending, or lifting can worsen it, while walking or lying down often eases it. Doctors diagnose the condition using your symptoms, a physical exam, and imaging such as X-ray or MRI. Most people improve without surgery. Spine societies favor a stepwise plan, starting with physical therapy and activity. Doctors may add anti-inflammatory medication, muscle relaxants, or targeted steroid injections to calm severe nerve pain. Surgery is considered when severe pain, weakness, or nerve compression persists after 3 to 6 months of care. Common operations include decompression to free trapped nerves, spinal fusion to stabilize a segment, or artificial disc replacement. Many spine operations now use minimally invasive techniques with smaller incisions, less blood loss, and shorter hospital stays. Recovery is gradual. Walking starts within days. Structured physiotherapy usually begins around 6 weeks after surgery. Every treatment has risks and limits. Ongoing exercise, healthy weight, and quitting smoking all protect the spine long term. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.